Welcome to PPL Talking. My guest today is Sal Anderton, who is Vice President and General Counsel for Porzio Governmental Affairs. His legislative work spans more than 20 years, and he has served as legislative counsel for the New Jersey Department of Labor and Workforce Development and for Assemblyman John F. McKeon. Today, Sal provides advisory and advocacy services in the healthcare, labor, and other sectors. Welcome, Sal.
Hi, Maria. Thanks for having me.
Thank you for being here. Before we get into some of the trends and topics in New Jersey, I would love for you to tell our audience a little bit more about your current work in government healthcare.
Sure. So, as you mentioned, there's about 20 years of experience in New Jersey state government, and the work really representing typically on behalf of healthcare providers and their statewide trade associations. We provide legal and legislative counsel to associations such as that. Additionally, vendors and vendors throughout state government healthcare delivery programs, whether it's state health benefits plan, Medicaid, even the Department of Insurance, in some instances, corrections, right? Healthcare delivery and corrections as well. So the same services, right? Legislative and legal counseling, not just as it relates to state compliance, but also to labor and employment issues.
Excellent. Well, that is a great background for our topic today. So let's get right into it. We want to talk a little bit about the primary healthcare issues that New Jersey is talking about and dealing with right now.
Well, this year, as I'm sure it is in a lot of other states, is the first year post-COVID where there's real financial stress on state budgets. So when it comes to, public healthcare delivery programs right now, fiscal concerns are paramount, particularly so here in New Jersey, as I'm sure elsewhere too, because our fiscal year ends June 30th. So funding, first and foremost, is a primary concern, more so this year than in past years.
Okay, that makes a lot of sense, and I think many other states are probably grappling with the same issues. Are there any specific issues within healthcare related to consumers that New Jersey is trying to address?
Yeah, sure. So particularly in New Jersey, as you know, is one of the most diverse states in the country, right? It's small, densely populated, and significant diversity, racial, ethnic, linguistic, socioeconomic diversity in our small area all bumps up against one another in close proximity. As a result, racial disparities, healthcare disparities, both as it relates to access and outcomes, are very apparent because of that demographic and because of the proximity and density of our state. So that's an issue I think in the past few years, and the Murphy administration has really kind of put forth front and center, and the considerations that evolve around such disparities.
It's a problem I think the whole nation is talking about, but it's specifically compounded, as you say, in some of our more diverse states, especially states that have dense urban areas and then sprawling rural areas, right, where there's not the sufficient healthcare system and resources to serve those communities.
And transit systems too, right? So it's tough in some instances to get folks to the care they need if they don't have their own needs.
Excellent. Yes. Great point to bring up. Within the health equity and health disparities conversation, my observation is so broad, right? There are so many issues to grapple with and to make sure that as a healthcare system we are addressing. From New Jersey's perspective, are there one or two specific areas within health disparities that the state is focusing on?
Yeah, thinking about disparities in the healthcare delivery system, I think two ways to look at it. One would be very basically life expectancy, right? And then, maternal and infant care, sort of like both sides of the lifespan of a person, right? So one statistic that I think is of really good and, really interesting and very insightful is life expectancy. Princeton and Trenton are probably like 12 miles apart, but worlds apart in terms of socioeconomic, fabric. Life expectancy as of 2022 in Trenton, city of Trenton, life expectancy of 73. Life expectancy in Princeton, 12 miles away, 87. Right.
Wow.
So just in terms of I guess life expectancy is a form of outcome, right? Obviously, a lot of factors that go into life, length of life, but that's an outcome. So a very, statistically a dramatic difference in that particular health outcome.
Wow, that is really an astounding statistic, and one I could see why it's such a focus for New Jersey. What specifically are the state legislatures and the New Jersey community doing to address the life expectancy issue?
So again, the Murphy administration has really kind of focused and brought these sort of issues to the forefront. What you've seen in the public discussion and the public discourse, in and around the state capitol and among policy and decision makers is a recognition that healthcare inequities are a function of the larger inequities in society, right? So whether that means public resources getting to where they need to be, right? There certainly are public resources available. Are they getting to where they need to be? So what you've seen is sort of an increased effort on the care of healthcare, on the part of healthcare systems, provide large providers, hospital systems of the sort, to really drill down into communities of color and communities where care, or even rural communities where care is a little bit tougher to access, right? So that's number one. There's also clearly, some cultural differences, whether, again, in a diverse state where you have cultural barriers to care and different types of care, particularly at end of life. So, and where you have family supports, right, that may or may not be available to patients at certain points in their healthcare journey. So those are just real top level issues that have been discussed, and efforts to shorten that divide have come really from some of the larger healthcare providers getting their services out to where they're needed, meeting their customers where they are, so to speak.
That's promising, and it's great to hear that there's a concerted effort to work on these particular concerns. The two things you mentioned about access to caregivers and even, some cultural concerns really make me think about self-direction and the self-determination programs and the participants within that, whereby they get to choose their own caregivers and essentially become an employer of the caregivers. Thinking about how it can help solve the problem by, I think, first giving access to more potential caregivers where there are none, or where there's a dearth of caregivers, right, in those rural communities and in underserved communities. So this program really seems like it could help close those gaps. And then on the cultural issues, like having family members who might be available to provide some of those personal care services, if they are able to be compensated under the self-direction program, and not have to do it as a part-time job in addition to a very full-time job to support their family, that can help close some gaps. I'm wondering on your opinion on that.
Yeah, that's true. But think about how much you just said, right? Like in our society, like if you go back 100 years, families were so large and all close together, right? In today's world, families are smaller. Adult children for older residents or for sick residents certainly aren't necessarily living in the same community, never mind same state or same house, right? So being able to choose your caregivers, right, gives you certainly gives you easier access to care. I think also, and having a discussion recently with policymakers here in New Jersey, who, as they hear about, directed care programs available in the state, like, that makes a lot of sense, because you get better care from people who are closer to you, who are familiar to you, who are comfortable to you. So it not only helps ease the difficulty with access, but probably also really delivers a better quality of care, just because it's familiar and personal.
That's an excellent point. I, having been a caregiver to one of my parents, they were really reticent to bring in people, and they just didn't feel comfortable with care, with the caregiving they were getting from agency personnel who they were not familiar with. And their continuity of care was better with familiar friends and family who can come in, they can be honest with them, and really make sure that, there's not only a continuation of care and stability of care, but they will also be able to, because of that stability, they recognize when there are changes, right, in the individual, when they might need something new or different to address their concerns.
Because of the familiarity. And, interesting, like, that's a moment in time, right? Perhaps. And this is just a thought that I've had based on my own experiences as a caregiver for parents and, family members. I've noticed that an older generation had a harder time accepting agency staff, right? That's just because they came from a different time. I don't know, maybe, but maybe folks of our generation and younger might have a different experience, and that changes the paradigm maybe in 15, 20, 30, 40 years from now. But at least now, with the population that's being served or needs to be served, I think that makes a difference for the positive.
Sal, thank you so much for being here today. We really appreciate your insights, and you've given us a lot to think about. And we'll be looking forward to see if there's a generational shift in how we all think about healthcare.
Maybe that's the subject for a future discussion.
I'm going to take you up on that, and we'll do a part 2 to this podcast. Thanks, everyone, for listening. See you next time on PPL Talking.